Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Heather Wagner. She's Director of Utilization Review and Case Management at Beacon Health System. And Wendy Reynolds, she's Director of Clinical Consultants at Xsolis. Welcome.
Happy to be here.
Thanks for having us.
Yeah, excited for this discussion. A lot going on. Some AI, imagine that these days. But even a lot of automation and other things to talk about. But before we go there, Heather, why don't you tell us about Beacon Health Systems and your role?
Yeah, hi. I am the director here of case management and utilization review. I get to work with some amazing teams in Northern Indiana and Southern Michigan working on discharge planning and the utilization review process.
Awesome. And Wendy, tell us about Xsolis and your role and also how you work with clients like Beacon.
Sure. So I'm the director of the clinical consultants here at Xsolis. I work with both prospective as well as current clients. I help to demonstrate the value and the capabilities of our platform. My past background as a former case management director, I really understand the day-to-day challenges that those teams face. And then my role is to help them see how our tools can help bring efficiency, reduce administrative burden, and ultimately improve workflow and outcomes.
Awesome. So Heather, talk to us what went into your decision to partner with Xsolis initially, and how did you make that decision and ended up with the partnership?
Yeah, so we actually partnered with Xsolis back in 2019. And so there was a lot of what we call paper processes that were contributing to a lot of inefficiencies. So we were printing pages for every patient, printing all of our clinicals to fax, and that was how we were doing our medical necessity reviews. For those who've been in utilization review long enough, you remember the medical necessity binders that you could flip through to figure out what's the right decision for our patient. So here at Beacon, we knew we had an opportunity to be more efficient, to make sure that we had our patients in the right level of care. And so that is why we moved forward with Xsolis in 2019.
That's awesome. And we're going to dive into some of the kind of more progressive features that Xsolis is rolling out. But what would you say are maybe some of your most valuable results early on from kind of moving from that, you said memories, I'd say bad memories of paper processes, to a more automated approach?
Yeah, so the first one was a big win, right? Getting rid of that antiquated paper process and really being able to have our team work remotely in a central fashion. So our team is able to manage the utilization review process for the entire system because of the technology that Xsolis brings to the table. We were also able to make significant impacts with our observation rate because we had that easy insight into the care level score with Xsolis, the triggers that said, hey, there might be the wrong status here. You should take a look at this case, and just brought a lot of efficiencies to the work that we were doing each day.
Interesting. And, a lot of organizations are acquiring, hospitals. It sounds like you were in a similar situation. How did that impact it as you kind of brought on new hospitals into your organization?
Yeah, so Xsolis, it was very streamlined. By the time that we had implemented Xsolis, we had a solid standard work. So it was easy to bring in those extra hospitals, new hospitals to our organization and say, hey, this is the way that we can do utilization review efficiently, bring those nurses on board. And every nurse we brought on board from other hospitals is grateful for the efficiencies and the technology that it brings to the table.
Yeah. I think, sometimes people think that adoption of technology is scary, but when you make, something more efficient, they love it.
That's right. That's right.
That's
And
awesome.
it's that AI component that at first is scary, right? If you've never used AI in your workflow, and once they start using it, they realize, oh, this is a great tool to allow me to think critically. So it's great.
I love that. Wendy, what would you add? How does this experience kind of compare to other Xsolis clients?
Sure. So what's really unique about Xsolis is that it's a shared platform used by both providers as well as payers. And across our entire client base, we consistently see improvements like this with efficiency. Staff are able to manage more cases without compromising quality. That's important. Increasing the ability to do more reviews, but the quality of those reviews stays consistent. And then what really stands out is how that platform aligns payer and provider views. Everyone sees the same thing, the same clinical story, making communication and decision-making much smoother.
Yeah, it's interesting. I heard someone say that, like, humans are often, inconsistent in their inconsistency, whereas at least technology is consistently inconsistent and you could fix it and do it. So
Yeah.
that's interesting to see that across your clients. Well, let's talk about some Gen AI stuff. Xsolis announced that it was going to be launching some pilots in late 2024, early 2025. These are some generative AI tools that can be offered in complement to, what Xsolis is doing with predictive AI. And Beacon, to your credit, was one of the first, it sounds like, to raise your hand to kind of pilot this medical necessity use case. So Heather, tell us, how has your team used it? How difficult was it to implement? Tell us about the process.
Sure. So we did implement Gen AI for our initial reviews at the very end of February, and we had our full team up and running by the beginning of April. So it was an easier implementation than other technologies because nothing was a hard stop, right? I could allow my nurses the chance to learn to trust the Gen AI. Listen, this week you just have to do 10 reviews, learn how to do it, feel comfortable with it, trust the tool. And then as soon as they started to trust the tool, then they fell in love with the tool. And so we had a progressive rollout of nurses. As they heard that other nurses were successful, they're like, when do I get to do this? And so we're getting calls like, please pick me next. I want to use this tool. I heard it's really great. So it was actually a fun rollout amongst our team. And it's been a pleasure to look back at the data and see the significant impact we've had. So we've been able to reduce the time it takes to complete that initial review by 68%. So we moved from 15 minutes to 4.7 minutes on average to complete that review. It's been great for our nurses because it allows them the time to critically think like a nurse. The Gen AI is out there digging for all of the data that they need to make a really good decision and puts it in a digestible format right in front of them, and they can just be nurses and do what they do best.
Wow. I mean, you use two key things that we've seen with adoption of technology. One is give them a taste so that then they're demanding more. I had that with an EHR. We started with a little, they're like, why aren't we doing it all? And you're like, okay, if you tell us to. And then, but also the competitive pressure, that's true. That's interesting that you use those to your advantage. But what amazing results, what's their response to this? Like, tell us more about kind of how they've reacted to the fact that they're now more efficient and what they're, how that impacts their workday.
Yeah, so since we've been able to shift our time with the nurses doing these initial reviews, we've been able to aggressively manage our cases in a better manner for the authorization process. Any cases that we need to follow up on sometimes fell to the wayside previously, and now they have the capacity to do that in a timely manner. And they feel more accomplished, right? Like I feel like I can finish some of my work that maybe I couldn't have previously. So that factor of accomplishment feels great as well.
Yeah, that's awesome. Wendy, what else would you add to this? And were you kind of expecting this kind of response and experience for them? And tell us more about, your perspective from the Xsolis side of things.
Yeah, sure. So that positive response from the payers during this pilot, it's been super exciting to see that Gen AI doesn't replace that payer collaboration that we already have happening through Dragonfly, but it enhances it. It enhances what we're already doing. That initial review that's generated, it's so comprehensive and well structured, it really sells that story to the payer. It gives the payers everything they need upfront, accelerating their decisions and reducing the need for that back and forth. They're still human in the loop. They still can review it, edit, and modify it if needed, which is really important that we keep that human in the loop. But it really helps to reduce that need for a lot of that back and forth.
Interesting. And are there other Gen AI tools on the horizon? Are there other ways that Xsolis is going to be solving kind of this administrative burden problem we have in healthcare for providers and quite frankly for payers as well?
Right. Yeah. And we're just getting started. So right now we're piloting an appeals letter use case with multi-care. We have several others in development, including a continued stay review, which is the next review after that initial review. Oftentimes payers will request a continued stay review. So that piece. And then we have several others, a workflow designed to support physician advisors. All of these tools aim to reduce administrative burdens, streamline administrative workflows so that those clinical teams and that healthcare system can really focus their time where it matters most.
Yeah. I mean, speaking of that, we're headed into HFMA. The annual conference is coming up really quickly. Wendy, maybe you could start, and then Heather, you could chime in as well. What should the
Yeah.
folks at HFMA and other financial clinical leaders who may be watching this video, what do they need to know as they kind of consider Gen AI solutions like the one that we've talked about, or even others like it? Wendy, why don't you start?
Sure. So AI in healthcare isn't just about speed or automation. It's about enabling your clinicians to work at the top of their license. By handling that administrative lift, tools like ours can help give nurses and physician advisors more time to apply their clinical expertise where it's really needed. And that's where the true value lies, not just in doing things faster, but in doing them smarter. And a critical part of our approach there, again, is keeping that human in the loop. We're not replacing clinicians, we're supporting them. The Gen AI provides the structure, clarity, efficiency, where clinicians remain that final decision maker. That balance is really what drives trust, adoption, and ultimately better outcomes. Our solution doesn't remove clinical judgment, it amplifies it. That Gen AI output, I think of it, it's a starting point. It's not an end point.
Yeah, I love how you're enabling them to, be more efficient, as Heather kind of said. What else would you add, Heather?
I mean, Wendy said it so well, but it really does allow us to lead our teams of nurses and let them be nurses. You hear that so often. You ask me to do this, 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 and this, and providing that tool to them to say, listen, we can give you this new tool to allow you to use that critical thinking and clinical thinking that you need and enjoy doing on a daily basis.
Yeah, it's interesting. We've heard this from like the AI medical scribes, the ambient clinical voice solutions, where it's like the freedom to actually be able to think about the process more fully, and kind of the cognitive overload of having to do all the details, and it sounds like when you remove that burden, you just described it, it frees them up to think more critically. Is that what, am I understanding you right, Heather?
Absolutely. And also, we're dealing with payers and really trying to reduce that friction with the payers that we work with. So if the nurse on both sides of the table is reviewing the same information in the same format, it really allows them to have a fair say about what's best for our patients for each case.
Amazing. Well, I love practical applications of AI that have actually been implemented. We've had a lot of talk about the potential, right? And so it's great to see, Xsolis together with Beacon, solving some of these problems and leveraging the technology. And to Wendy's point, right, your connection that you already have with the payers in a more effective way. So I appreciate you coming on the show to talk about this excellent solution. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks so much.